Hello YouTube, this is SippedChick again with an update on my weight loss surgery uh, timeline. And just want to add to this video in the beginning, well, I want to revisit something I mentioned in the past video that I was not able to reveal any dates because I was having such a stressful time at my job. Just to briefly tell you what happened. I started the job a few months back, not very long, not even 90 days. But when I started the position, I let the employer know that this surgery was coming up, and they didn't seem to have a problem with it at the time. But they did say that this is our slow period, our busy period. So February will be our slower season due to the nature of the work that we do there, and I won't reveal that. But so I waited. I actually got a call from my surgeon's office in December. They wanted to do the surgery then, December of 2014. And since I just started the job, I was trying to be a really good employee, trying to, be a team player, and just be there when they needed me. I didn't think it would make a very good impression if I started a job and, oh, by the way, I'm taking off a whole week next week, to do the surgery. When basically I could have, I guess, but I thought I was going to be there for a while, so I tried to do my best to accommodate them as best as I could. And February came, and I put in my notice for the time off, how long I was going to need off. I said max 2 weeks, 1 week, maybe all I needed. And my time was denied. And not only that, to add insult to injury, the person who was in charge of approving this request, it was over my boss, and she had the gastric bypass a year ago. And that was a shocker to me, because you would think someone who had gone through it, who has struggled with their weight, who has had, various comorbidities, dealing with their health and trying to get their health back, in good standing again, would understand. I thought the situation would have been ideal, and it was not. I've been stalked and harassed at work about what I eat, what I drink, what am I doing. I've had one person come up to me and tell me that my shakes look disgusting. The protein shakes that I was drinking, did not ask for their opinion. I mean, this was just unsolicited, out of the blue, sporadic. I'm in the break room area, and I'm making my drink, and I'm asked, what's that? And I said, oh, it's my protein shake. And then the person says, that looks really gross. And I wanted to say, who asked you? Anyway, fast forward, I have some good news. I have been offered another position elsewhere. Full-time benefits. So I'm really looking forward to that. So, my advice to anyone having the surgery, do it at your own discretion. But if I had it to do over again, I would not have ever mentioned my plans to have bariatric surgery. People have a lot of weird reactions to people who, those who are seeking out to have the surgery done. For me, the common response was they would give me a glance over and say, you don't need it. But they don't know that I am severely diabetic. I was just prescribed insulin a year ago, and I have watched my health deteriorate regardless of weight gain. I didn't even gain any weight, and I watched it get worse. So they don't know that, and they're not there to watch you have to shoot up insulin at every meal and once a night, and take metformin pills and blood pressure medicine. And I'll review my age, I'm only 37, and I've been on blood pressure medicine since I was 25. I was diagnosed with diabetes when I was 29, and last year I was, 36. and I was being prescribed 2 insulins on top of an oral medication for diabetes. So they don't know. They don't understand. They don't get it. They see these shows on TV when they talk about gastric bypass surgery, and it's always, most of the time, it's someone who's super obese, like in the 500, 600 pound range or something like that. So they always associate gastric bypass surgeries or any type of weight loss surgery with someone who is that heavy. And it's not about being that heavy. It's a combination of things. It's a combination of what type of health problems you've had, how long you've had them, your BMI. You can't just go in and I've tried explaining this too. You can't just say, oh, I don't like being a size 16. I want to be a size 4, so I'm going to get the gastric bypass. Well, if you're not obese or a certain BMI and you don't have any comorbidities, depending upon your insurance company, of course, you can't just walk in and say, okay, give me the surgery. You have to go through a battery of tests. You have to have several doctor examinations and a case history of health problems or some type of proof that you have attempted weight loss, different types of weight loss methods and have been unsuccessful. So, people just don't get it. So my advice to anybody, if you would seriously think about revealing any details about your health to your colleagues at work, because they may seem friendly, but they may have some type of stigma against weight loss surgery, or they may have some personal just issues with it that you may not even know about until you decide to share that with them, and then you may see a totally different personality, and they may start treating you differently, and so just be careful when you decide to share that with someone. Anyway, okay, back to the current. Good news, new job coming up. I am 5 days post-op, and I had my surgery on March 6th, and miraculously, I was released the next day. They released me about 7:45 p.m. that Saturday. So, and the hospital stay was rough. It was my first time being in a hospital. The worst part of my stay was the problems I had with my IV. Apparently I have small veins, or I clot or something. They were telling me that I clot. So anytime they would unhook me from my IV, like when I went down, I had to go do my upper GI test to make sure I didn't have any leaks, to do the barium swallow, which went great. I had no leaks, no type of what they call strictures or whatever it was they look for. Excuse me. That's another thing with drinking. After surgery, I do have experienced a lot of gas. When I just had a protein check a few minutes ago, or a little bit of it. And that's another thing. I have to drink everything in. So far, I've worked my way up to about 3 ounces every 15 minutes. And I can do it comfortably without feeling too tight. But I do still have like that gas thing, like a burp, like every time I drink or something. Hopefully that'll go away, or I'm not sure how I'm swallowing air or something, but I'll talk with my surgeon about that. This is only day 5 post-op. So yeah, the surgery itself, how did it feel? What do I remember? There was a delay, which I wasn't really happy about, because I was really trying to get in and out of there, as quickly as I could. I didn't think I would be out the next day. I thought maybe 2 days. They told me to expect to be in the hospital for 2 nights. And, I had it fixed in my mind that it was only 2 nights, and even though it was uncomfortable, I knew I had one more night to go. And they decided to let me go the second day because I was swallowing, I was voiding, number 1 and number 2. Yeah, and they gave me a laxative in pill form, which I was very nervous about that, because I know I'm not supposed to take anything solid until I think the first 30 days or something after the surgery. And this was like right after the surgery, the day after, that morning. And when I took it, I mean, I kept asking the nurse, "Are you sure? Are you sure?" And she reassured me that it was ordered. So I'm like, okay. It was two little small pink pills. I guess it was I forget what it's called. It's the supposedly the gentle laxative. I forget the brand name, but anyway, it was little pink pills. I took them, and within a few seconds, I started salivating. I could feel it building up. I was like, oh God, I'm going to puke. And the nurse didn't seem concerned about that. I'm like, hello, can you hand me a pan or something? The bedside manner was horrible. I won't reveal the name of the hospital, but the bedside manner was horrible. They stuck me several times in my arm for IV and would hook it up again and try to use the same IV, and my whole arm and hand would go numb and it would burn. That pain, excuse me, that pain was worse than the surgical pain, than them ripping me up in my guts and stapling me. I handled that pain better than the IV pain. I was amazed because they took me off of the IV after I was screaming and hollering because I was in agony. And I'm glad no one came to visit me that one day because, oh my God, I did not want anybody to see me like that because that was not a accurate picture of the whole experience. So they took me off the IV, so I was not on any fluids, any pain medicine at all for hours. And I was fine. I couldn't believe it. I'm like, okay, I'm not getting administered any pain medicine, and my stomach, I mean, of course it was sore and I couldn't get comfortable, and I accepted that. I was okay with that. I would rather deal with that than to deal with the IV burning my arm, and I mean, my arm was on fire. I never felt pain like that. I can't remember feeling pain like that. That was just insane. But anyway, so not long after that happened, I called my bariatric nurse and told her what was going on and how I was being treated. And maybe an hour or so later, I don't know if this was connected or not. My surgeon's PA showed up, and they still had me on a catheter, but they gave me a laxative. Now I'm like, if I'm expected to get up and go to the bathroom and do that, why am I still on the catheter? So they decided to discharge me, and they told me that to be discharged, I had to make sure I was able to void on my own. Great. So they take the catheter out, and I'm drained, and I can't take in, at the time, I couldn't take in more than an ounce of liquid at a time, and I'm expected to void. I'm like, how in the world they expect me to do that? I felt like they were trying to keep me, but I'm like, why are they trying to keep me? I'm doing everything else. I'm keeping down my liquids. I'm not nauseous. I'm not vomiting, and I don't have any leaks. And I was up walking around like regular, almost like a regular, like I belong there. So anyway, I ended up finally getting the paperwork and all that together and released by 8 o'clock on Saturday. So I only stayed in there one night for this surgery. SIPS, yes. And they did it laparoscopically, and I only have like 6 incisions, and they're about, say, maybe an inch and a half long, if that, maybe an inch long, anywhere between an inch and a half. And there's 6 of them. There's one just under my breast, and then three like in my mid abdomen, and then one maybe kind of on the side. So when they heal, I mean, it looks like nothing now, but when they heal, it's going to be like maybe little tiny scratches. It'll look like. So there's there's going to be barely any scarring. So that's how everything's going. I'm tolerating liquids. I am drinking right now. I'm working on this protein shake. It's just a regular shake I got from Walmart. It's the Atkins whatever dark chocolate royal shake or whatever. And it only has 15 grams of protein. But what you gotta remember is that I forgot this. When you drink your shakes, it counts towards your 64 ounces per day. I was freaking out like day 2. I was like, oh my God, I can't get it down. And the shake that I mixed up, I put, because they want you to aim for 60 to 80 grams of protein a day. And I don't like just doing the bare minimum. So I was trying to get 80, and I managed to get like 65. But what I did one day is take my bariatric advantage shake mix and mixed it with an EAS, and it was so thick I struggled to drink it. It was like I felt like a kid at the table who didn't want to eat their dinner. And I had to sit at my table and just like not do anything else and just be my own parent and say, no, you're going to drink this. Okay, it's 15 minutes. It's time to take another ounce or 2 ounces. And it didn't hurt, but it was very uncomfortable. It felt super tight. And that's how I know it's actually working. It's actually that small, because there's no way in the world I could have drank in the past 2 ounces and feel stuffed. I'm like, that's just unheard of. So I'm enjoying that, and I'm getting exercise and walking around, and just in my neighborhood, nothing strenuous. Oh, and I mentioned a problem with gas. Some people have it, some people don't. For some reason, I have horrible gas, and it gets trapped in my abdomen, and I can't get it out. So what I have been taking is, and I read this online, and I think it's pretty much safe to take anything that is dissolvable. So I got these gas X strips. You can get them from, I got mine, I don't know what area of the country you live in, but I got mine from Harris Teeter, which is a popular grocery store here where I live. And they're just, they're really small. I can open one just so you can see what they look like. And, you know, it's really thin. Like, it looks like a little pack of gum or something. And you just open it, you peel it, and I made bacon. I do feel I've been having a bad case of the bubble guts. So this is what it looks like. It looks like a piece of gum, like kind of reminds me of spearmint gum. It's really thin, and it melts on your tongue. And you can chew it if you want, and help it go down faster. That's what I do, and it hasn't bothered me any. So yeah, I'm trying to think of anything else I'm missing or forgetting to mention about this whole. Oh, my stats. Okay, I'll just end with that. My stats, I didn't want to reveal them, like, oh my God, what if it doesn't go down any, or goes higher? I'm like, oh, this is embarrassing. Okay, I'll be honest. Okay, so when I enrolled at the bariatric clinic back in, was it October? My first doctor's visit with my surgeon. My weight was 265. I'm 5'7", and the day of surgery, I was 240. So I lost 25 pounds total pre-op. So right now I'm hovering around 240, and I may have gained a few pounds in the hospital from the IV and the water and stuff, and that's expected. But in the past couple of days, it's gone back down. I think I may have gone up to maybe 245, and it's like it was 241 this morning. So it's coming back down. I hope it's just not water weight, because I'm like, I want it to be fat weight, not water weight. But anyway, I have gone on for about 18 minutes now, almost 19. So I'm gonna sign off now, and I'm relieved I had this surgery. I don't regret it at all so far. No complications, just minor annoying stuff like gas and kind of burping type things, and moving around helps, and pain medicine helps. Sleeping better. Can't think of anything else. But if you have any questions, you can email me on YouTube, or you can email me at SippedChick@gmail.com. That's SippedChick@gmail.com. Till next time, live well.